Hi all, very good morning. So today we are going to deal with genitourinary system diagnostic procedure, that is kidney biopsy. Earlier we had discussed about RFT, right? So now we are going to discuss about kidney biopsy. So I think so in few conditions and all I had repeatedly said in the diagnostic evaluation, that is biopsy. Now what is biopsy? Biopsy is nothing, it's a diagnostic procedure. We will be scraping a small piece of tissue and it will be keeping under the microscope for examination. Now when it is coming to kidney biopsy, that means from the kidney we are taking small piece of tissue and it is went for examination to know the better to give the better treatment. Okay, now how should we prepare a patient for biopsy? Now you know what is a biopsy. We are just scraping. It's like a small needle is inserted. Needle, you know, right? In a syringe, you know a needle how much it is. Okay, from that we are just scraping like this. So this much only will be there. So how we are going to prepare the patient before procedure and after procedure? Okay, first and the foremost is the patient consent. Okay, patient concern should be there and we have to explain the procedure before taking. You should not go and tell, come on, you have a procedure, come on, sign on this. No, you should say, sir, we have a procedure. Okay, it's a biopsy, a small needle will be inserted and we will be scraping it. It is a painless or invasive procedure. Okay, what after that what will happen, everything we explain it, and then, sir, please give a sign on this paper. Okay, consent. Okay, complete history collection should be there. Why? Because if there is any known cause, okay, known history of any drug allergies, okay, then avoid aspirin and blood thinning medication for 1 to 2 weeks before the procedure. Now you know, we will now suppose doctor is, you have come and visited the doctor. Okay, so we will be like, okay, after 2 weeks we will be doing the biopsy. Till that you stop this medication. Okay, so aspirin and blood thinning medications will be stopped before 1 to 2 weeks. Okay, then light foot and NPO before procedure. What is NPO? Nil per oral, or NPM, nil per mouth. Okay, from the last night. If tomorrow morning is the procedure, today night after 10 o'clock, nothing will be given through orally. Okay, then as per the severity of the condition. Fine. Then blood test and urine test to know whether there is any risk why after taking biopsy. See, if the person is very much anemic and all, sometimes bleeding and all will be the complication. So we have to see the blood test and the urine test, as well as HIV, HBsAg and all test we have to do. Okay, then that is before the procedure. Okay, preparing the patient for the procedure. Now after the kidney biopsy, what will be the patient should be kept in supine position. Now back to the positions. I hope you all remember first year. So patient should be kept in the supine position for few hours. Okay, at the same time, if the person has undergone a kidney transplant, okay, a kidney transplant patient after biopsy should be lying on the stomach or in the prone position, not supine position. Okay, then monitor the vitals. We have to monitor the vitals as well as blood sample, especially CBC, to know the HB count. Why? Because if there is any blood loss from the biopsy site. Okay, then monitor the patient. Actually, this is an invasive small procedure, so that day only the patient can leave the hospital. Okay, the same day the person can leave the hospital. Patient will notice some bleeding, okay, in the urine or like hematuria for at least 24 hours, not more than that. Okay, now what are the risk factors of kidney biopsy? Bleeding will be there, as I tell, 24 hours. Hematuria will be there. Then infection in the biopsy site, like a wound. Okay, small wound like injection site and all, you will be having like that, a small thing will be there. Sometimes the person, if it is diabetic and all, sometimes it will get pus formation and all, sometimes, rarely. Okay, then what are the complications is like infection will be there, hematuria for more than 24 hours, then it is a complication. See, I have clearly said the patient will be having hematuria for 24 hours. If it is more than that, that means something is wrong with the patient. That is a complication of biopsy. Dysuria will be there, anuria. Find out. Then fever will be there, worsening pain in the biopsy site will be, if it is there. Actually it won't be usually seen, but if sometimes for some patient as per the situation, sometimes if there is any pain in the flank region and all, then dizziness will be there as a complication. Okay, now biopsy, see, for all the blood report or all the tests, whatever we do, we'll get it within 1 or 2 days or on the same day. Okay, but in biopsy's case, doctor will be keeping, the result will be taken for few days, like 10 to 14 days. Okay, because that sample is kept under the microscope, okay, to learn what is the cell. Is the cell growing? Okay, is the cell growing with the maturity, or it is not getting matured and just growing, or it is a carcinomic cell? Okay, to find out, the biopsy result will take 10 to 14 days. Okay, so this was all about kidney biopsy. I hope you all understood. Fine. If there is any doubt, please get back to me. Thank you.